Today we have Dr. Sufyan Ibrahim here, who's got matched in neurosurgery in Oklahoma. He has been a graduate recently from KMC Manipal. You all know it's a very renowned med school across India and Asia, I would say. We'd like to know more about you, Dr. Sufyan. If you can, just tell us more about yourself, and then we'll switch over and slowly start getting into your journey of USMLE and the US residency.
Hello, everyone. Very happy to be here and be sharing some part of my life with you all today. Yeah, I am a medical student. I joined MBBS at KMC Manipal in 2015 and graduated in 2022. And then did my research at Mayo and matched here at University of Oklahoma in 2024. So that's been sort of my journey in brief.
Great. So you mentioned you started your med school in 2015, right?
Right.
So which year of medicine were you studying in when you actually started off with your US journey, or you thought that, okay, fine, US is the destination that I want to get into, and then you started off with your US plans?
Sure. I would say that I definitely knew that I wanted to pursue neurosurgery well before even entering medical school, but
Oh,
where that would be happening was not really clear till probably in the initial half of my first year of med school. Um, Manipal has a great culture and sort of a tradition of having alumni secure residencies at international universities in UK, US, Australia. So that sort of had an implication in me also wanting to move outside of India to try for residency. So I would say that definitely in the first year, um, when I attended one of the events from Kaplan, is when it sort of made me inclined towards pursuing residency in the States. But as everybody kept saying, neurosurgery is the top of the tier. So it was already known that what I was venturing on was hard, but still, I would say that I was hell bent from the very first year that if I want to do neurosurgery and in the US, I'm not gonna switch my field of interest just to be in the place of interest. So basically, I wanted to do both neurosurgery and in the United States.
great, great, great. I mean, I'm really surprised, and I'm in fact happy, I would say, that at least before getting into med school, you were quite predetermined that you wanted to do a neurosurgery only. Because on and off, I do, meet students and even interns, especially when I ask them, um, you want to get into US, or have you started off with your USMLE plans, or what specialty you want to get into? And I'm surprised to see that even interns, at times, they say, I've not decided what I want to get into. So that could certainly be a red flag for students if they haven't decided what they would want to get into. So yeah, I mean, decide as early as you can is what a tip that I guess we can give to our audience here, right? Um, any now, of course, it's a personal choice. What do you want to get into? But when did this thought of neurosurgery struck your mind, and why?
It is quite funny because I think I have no medical or background of medicine in my family. Everybody has been involved with fish business, so there has been no medical background. Although I am a localite from Manipal, Malpe region, uh, but I think it was in class 12th where or 11th when the teacher kept asking what everybody wanted to be, and we were in the biology batch, so everybody wanted to be a doctor back then. So she was annoyed and she said, "You can't just tell that you want to be a doctor. You have to say something more specific." And um, I think I was watching a few TV shows where it feel it felt cool to sound or say that you're a neurosurgeon. So it was funny. It started off with that, but yeah, it was more like an infatuation towards anything neuro related. And I think in first year of anatomy itself, when they started discussing neuroanatomy, neurophysiology, I just felt even more in love with the subject, and that just kept strengthening my already surplus interest I had in neurosurgery.
Well, I can just feel and I can just observe you're trying to be very calm, composed, and which I mean you're a down to earth person that I know you are for the last close to 10 years or so. You're trying to say that you didn't really take that those many efforts, but I know what hardships that you've gone through. In fact, I was just invited in your college, and last week when I was there, I was so proud to see your name in the outgoing batch top list. So you topped the med school as well. I'm really happy and proud for you.
Thank you. I really
Yeah.
appreciate it.
Right. So now, can you just tell more about your USMLE journey and the hardships and how long did it take for you to clear the USMLE steps?
Absolutely. So, as I mentioned, the journey was mentally prepared or started initially from my first year of med school. Um, I sort of made a plan of what my next 10 year of my life should look like or would be looking like. There was obviously no certainties to that plan, but I clearly remember in a blank sheet of paper writing 2015, 2016 to 2025, all the 10 years, what my life would look like, and how I would be progressing throughout med school and beyond, and when or during what year I plan to match. So I decided to give my step one during third year of my med school and give my step two during the intern year of my med school. And also do my rotations during my internship extension period. And then I was made aware that securing surgical or competitive specialties in US demands more than the normal traditional pathway. So they are expecting you to be in the United States, learn the people in your field that you're applying to. So I was sure that I wanted to secure some research positions. So I planned even that after my graduation, and initially did plan to apply in the cycle for 2025, but later on I went ahead with applying last year. Fortunately, all of that worked out for me, but that's briefly what my USMLE journey did look like.
Great. Now, we all know that getting a surgical seat is not that easy, and you really have to, have a lot of things to be added to your CV. How important was CV building for you, and what all things did you actively take care of to ensure that these components are a part of your CV?
For sure. I think I would start off by saying that a lot of times people think CV is something that you have to keep adding on to, but to me it felt like you being in a med school is the starting point for your CV, because people want to be aware of where you are coming from and what you even did in that place. Being in a med school is a long journey, so you want to make sure that you take the best out of your med school as possible. Every med school has great things to offer. A lot of times the students themselves are not even aware of what is in offer at their own med school. I can say the same things about KMC Manipal, one of the best schools for medicine in India, probably anywhere in the world. Great academic curriculum, but also the support that we had for extracurriculars, people that are interested in sports, people like me that like quizzing, people that love research. Everything was, provided for, or like there was some assistance for all of that. So I knew that I had to take advantage of all of that, because eventually whatever I made out of it will be a part of my CV. Specifically for neurosurgery, they expect a lot of research productivity. So I started research well within my first year of med school. I tried getting the ICMR STS grants, which I was able to during my second year. And then I did like a research activity pretty much in every subject, every department of my med school, which with whichever mentor I could find. Most of those translated into research publications. A lot of them I could present as posters or oral presentations at conferences. I probably attended 50 to 60 quizzes, intercollegiate events as a med student. So wasn't like I was just at home sitting and studying. I love to roam around and get the free attendance that comes with it. So I sort of enjoyed all that journey. But whenever time came, I knew that I was in a med school for a reason. So there has to be the priority that you do well in your med school exams. So I always made sure that, that was my number one priority when the time came. So at least the month leading into any of the med school exams, I would put my heart and soul into it. I would say I probably studied the most during my first year of med school than anything after that. So that really helps. Just having that basic science understanding just changes the way your med school progresses. So all of that I think really helped me get those extra lines in my CV. But then again, for neurosurgery, I knew that I had to come to US, do that extra research with the surgeons here, so that your name is in the author list with other neurosurgeons that people recognize here. Because no matter how much of work you do in India, there is always a question that you know um, like nobody attesting to your performance, because that's just how the nature of this process is, unfortunately. So I did come to US, worked as a postdoc at Mayo Clinic with Dr. Biden in the neuroinformatics lab, and then try to get as much as papers out of that I could. I always knew that for a surgical specialty, especially, you also need to show interest inside the OR. So you have to almost like it's expected that you do some rotations to get good letters out of your rotations. So I knew that I have to be doing electives or observerships, whatever I could get. So yeah, all of that sort of added on to each other. So med school profile, research profile, quizzes, and other competitions, and the postdoc I did pretty much sums up my CV.
That's wonderful. And that's exactly what most of the students end up missing out on, adding these things. I mean, it's definitely a very tough journey to, get into there. So students, if you're watching this, this is exactly how, we would want you to have your CV, not just CV. I mean, CV is a very fancy word, but it's all about the efforts that you take to be there. Now, while talking a while ago, no, Sufyan, you just mentioned something about quizzes, and I can't deny you are one of the very few students that I personally follow on social media and on your Instagram, ornate.brood. I have seen you winning, a debate competition, you winning quiz competition, I guess a couple of them in Father Muller's and other places. So I have seen that. I can testify that yes, you have really, done a lot to be there, and I believe you, yeah, certainly deserve where you are today. Now, you also mentioned about surgery. So, since you've explained everything in detail, if I may just ask you one simple small question. If you had to quantify a number, how many researchers or publications you may have had from the first year till date?
Right.
Approximately.
So yeah, I mean, I really don't like people holding on to standards that you know somebody else has done, because then it just becomes n is equal to one sample size. So I always recommend students to go through the NRMP charting outcomes and see what exactly is the mean and the standard deviation for research. But I can tell you, in my case, I had about 55 to 60 publications when I applied. I would say like 50% of them were from my med school. A lot of it during my internship, where I had some really good mentors. And then a lot of other research came from the lab that I worked in, which is probably one of the most productive neurosurgery labs in United States. But again, like, that doesn't mean everybody has to do that. I can tell you that there are people who have done far more than me that were unfortunate and could not match, and there are people who did far lesser than me but were fortunate to match. So just go by an average that is published every year by the NRMP, just so that you're meeting, that's expectation. The expectation for an IMG in neurosurgery, trust me, is 5 to 10 times more than a normal American graduate. So you can imagine that you have to show that productivity in every action. Your scores, your medical school profile, your research, everything is, you have a different bar to match as an IMG. So it's possible that in some areas you might lack, but if that happens, then you just have to make it 20 times the effort and match it with some other aspect of your CV.
When did you even get time to study for your MBBS is the question.
That's what I keep telling people. We all have time. I did all of this, but since I was a localite, I also made sure as much as I can. Although my family would deny that, I tried to be as social with my family, tried to attend those events because to me personally, they are as important, probably more important than my medical career. But I think we have time. I remember sweating my nights out. I'm not a fairly morning person, although that has changed in the residency that I've begun. But I would stay up like an owl the whole night and do my research. Um, with quizzes and med school, I think they complement each other because it's, don't ever think of preparing for an exam as you're preparing for that one exam. Think of it as that one patient you'll be treating someday in some aspect of your life. If you think of it as a long term goal, it always helps. But if you're just thinking of it as a something that you need to memorize before the night for an exam the day after, then probably it just like slips your memory. Your brain will only act in the way that you want it to act. So I kept telling myself that one day I'll be treating that patient with the weirdest syndrome. I love learning those zebras in medicine. So that's probably what kept me motivated to do research, to do quizzes, to also make sure that med school still continues to be my number one priority.
Great. Uh, I know it's a very wrong and or maybe an odd question to answer because I know of that there's no standard answer to it. But what would be the minimum average magical number of research or publications that you would want to suggest our students and audience here that at least have a minimum of so many for you to be even be able to show your face during your interview? What would that number be?
Again, like I have asked the same question to a lot of program directors, and the answers of program directors have ranged anywhere between greater than one to another program director telling me that I won't interview an IMG if he or she doesn't have a Nobel laureate, a Nobel Prize. So the range is that wide. But personally, I would say if you can have at least 20, probably 2025 publication indexed in PubMed is what I would target. But I can attest, knowing a lot of American med students also right now, that that is a number that the American med student is able to achieve these days. So the number is exponentially increasing every year. So if you are planning this for, say, 3 years later that you want to apply neurosurgery, probably that number has already gone up. So it's not a static number, unfortunately. There are specialties that are trying to sort of stop this research and publication arms race, but I really don't know when that will go into effect. What you can do as a IMG is continue to try get as much as you can. So I would still want to have 20 to 25 PubMed index publications, but I'll also make sure that I've presented or done a sort of poster presentation for all those publications in an international event, because you upload in your ERAS the publications and your poster or other presentations separately. So the average that you see on the NRMP charting outcomes is a combination of everything. So that's how it comes to 50, 60, 70. But yeah, I would still want to be above that average number.
That's great. Yeah, in fact, Yeah, I mean, as we mentioned, the number that you mentioned could be right, could be less, could be more, but this is definitely something that students should look into so that they can pull up their socks and start working into it. And if they think they have the potential, why not? They should definitely go for it. Um, Now, there's also one question wherein the students, maybe as early as first year or second year, they are definitely not uh, exposed to the clinical side of it. So, as a first year and second year student, what kind of topics would you recommend students to start off with? Because this is one thing where students don't know what to start off with, and they say, "Oh, I want to get into surgery, but I don't know ABC of it." So, what topics? What would you suggest the students here?
Right, that's a very good question, especially because in India, the curriculum is so rigid. You barely have any elective rotation to, decide your planning, which is very different from how an American student does his or her medical school, because here they actively get to choose what rotations they want to be doing. So somebody interested in dermatology can do a dermat rotation and not do a neurosurgery rotation, whereas in India you have those fixed rotations, so it just becomes harder to choose what probably you like or you dislike. That is why exactly I did the, as I mentioned, like one research activity with pretty much every department that I could possibly think of. um, it's always good to start whatever you're doing with your preclinical years, because the faculty in your preclinical years are, I would say, kinder and have a lot more time to spend with you and make you understand and be aware of what is expected. Like, doing research might sound easy, but trust me, it takes so much efforts to just get one publication out there. And just even having the knowledge of how a protocol is written, how to get the ethical clearance, how to write the paper, how to do the data abstraction, how to interpret your results, all of that is not a single day task. It's a long time journey for one paper. So just to get that brief understanding, it's always good to start with a preclinical or a paraclinical. I would say one of the best departments would be community medicine, to help you just get oriented to what is expected, because they have a lot of structure in their curriculum. Uh, Not saying that you cannot approach clinical staff, but a lot of times they're so busy in India, especially with their patients. It's just hard to find time to deliberately teach you how the nitty gritties of research works. Another way some of my friends decided what they probably would like to do is go the extra mile, because pretty much every Indian med school that I am aware of has their day like done by 4:30, 5 o'clock. So you have to go that extra mile to stay in the OPD or the emergency, the ORs of that respective department. After that, spend some time with the actual residents, because any hospital will still be active even when your day is done after 5. They will have their residents still working, their postgraduates still in the hospital. So just see if that is sort of the life that you think you would be happy with. So that's the only two ways I can say that you can decide if you like it or you don't like it, because a lot of times it's easier to read a textbook and think that you like it, but when you're actually experiencing it, you probably wonder, do you really like it, or do you see yourself doing it for the rest of your life? So it's good to have that exposure. For a lot of major specialties that IMGs target, like internal medicine and pediatrics, I believe there's sufficient exposure rigidly within the curriculum. We have enough postings for those specialties from the second year of our med school. So if you think that is what you like, then probably it's good for you. But people interested, say, urology, dermatology, or say the fellowships for cardiology, etc., which are not really covered in our undergraduate curriculum, I think you have to go and spend some time with those departments, with those doctors, because I think anytime the department would be happy to have an extra hand to help with anything. So just try your best to spend some time with those people.
I guess it's all about passion as well, some
Yeah.
initiative that you take from your side as well. Sorry. Now, a while ago, you also mentioned about journals like PubMeds and all. Uh, some time back, you also mentioned that you got your ICMR's STS funded, program and got that published there. You also mentioned you did about 55, 60 odd publications. I'm pretty sure not all 55, 60 must be in the ICMR. You must have taken help of PubMed's, one of the journals, Curious and all. What are the other options that you would want to suggest the student that if they do not get, because at this point in time there could be many students who are third year final year interns who are watching this discussion of ours, and by then, you know ICMR is gone an option, they do not have that any longer. I don't want them to lose hope, so which are the other places that you would want them to suggest and try their hands on in getting their research published?
Right. So there is this misconception that you need a lot of money for all the research, which is largely untrue. I mean, you definitely need good amount of money for doing some breakthrough sort of research, but to start out, we are not like targeting world breaking research. We're just doing some observational studies, and a lot of times it's very easier to do it in a country like India because the regulations are far more, you know,
Relaxed.
helpful in some ways to promote that research culture because it's very severely lacking. I would say, so what ICMR does is gives just grant for completing the research. And in my case, it was just 10,000 rupees and um, probably didn't even help as much. A lot of difficulty happens when you're trying to publish the research. So a lot of journals charge a lot of money for that publications, easily between like $1,000 to $2,000. So that becomes a hassle. But there are, I would say, like every specialty has their, uh, like in neurosurgery, for example, they have their specialty specific journals, which usually do not charge at all for publishing unless you want it like a gold open access or something like that sort. So a lot of times there are enough journals in the specialty that you're looking for which publish your research free of cost. You don't pay a single dime. Um, and then another means of doing it, I was fortunate to be in Manipal, so we had a lot of research support from something called Praise in Manipal that would provide students and even the faculty with grants, research funding for publication, and also like some sort of incentive for publishing more. I believe that would be a scenario in a lot of other med schools in India and otherwise. Um, there are independent organizations also, like for India, the DST, DBT. There are a bunch of other organizations that fund initial or sort of early career investigators. You just have to make sure that your research is a serious thing because there are people who are legitimately spending their time reviewing your protocol, making sure something good comes out of it. So you don't want to just be doing it to fill your CV box. That should never be your intention to do any sort of research, very honestly. So if you're very serious about doing something meaningful, there are enough avenues within India, governmental and non-governmental. So, for example, you can look for any sort of tumor research. There are enough tumor-specific societies, say breast cancer or stomach cancers, that fund any early career investigator to do their research. And one of the best advice I would give is approach the mentor. The right mentor would guide you better on finding those avenues in which you can start funding your research. But a lot of research that you can do as a medical medicine undergraduate is retrospective, for which the data is lying there in the MRD of your hospital. Like just somebody needs to open those files, open those charts, and start collecting. If you are ready to put that effort, a lot of that doesn't cost money. All it costs is your time and effort. So if you are really so passionate, it shouldn't be that hard.
Oh, great. One of the most important aspect of your CV is your clinical rotations. Tell us more about your journey of clinical rotations. How many rotations did you do? Were those hands-on? Which all places? And how early did you start applying those? Were those through VSLO, non-VSLO? Those kind of generic things that we would want to know from you.
Definitely. So again, Manipal is a VSLO affiliated institute. Um, so people that are interested in pursuing rotations, it's really helpful. Having said that, something like neurosurgery in the United States, they don't care if you're VSLO or not, if you're an IMG. So the only rotation that I got through VSLO was the Mayo Clinic rotation, which is probably one of the only neurosurgery rotation that is open to accepting IMGs on VSLO. And you don't pay a lot if you're applying through VSLO. It's just, I think it was $100 for my Mayo application and no extra tuition fees. The other rotation I did was Barrow. That was through a direct email reach out to the organization. Um, then I would also say that during my time, I did these in 2022, just before my graduation in Jan and February. It was also the time I wanted to be doing those in the late of 2021. The problem was that India was, struck with COVID, and US was not accepting Indian tourists or people visiting US for whatever reason, because it was one of the epicenters for COVID, and they weren't even getting a visa. And if you're a visa requiring IMG, which was the case in my process, so I even struggled getting the visa on time. So I had to reschedule my rotations to 2022, but somehow it all worked out. So it's good to do those rotations uh, for any specialty, but more so for specialties that want you to be like, using your hands-on skills. So any surgical specialty in particular. Another reason for doing those rotations is because something like neurosurgery, I knew that I need a postdoctoral research position. So when I did those rotations, it was easier to reach out to faculty in person, meet them, and request for some research positions with them, because there are every institute in United States would have a department that would have some people that work in the lab. So you can reach out to those professors directly and ask them if you can be a part of their lab. And that's pretty much what I did at Mayo, and secured my postdoc at the neuroinformatics lab. Um, but then when you go back after doing your postdoc, when you know that it's time to apply, there would already be such a significant gap in your clinical years that it can be questioned during your interview. So what I did was, just before last September, I did a couple more um, observerships here at Oklahoma, as well as at Penn State Health in Hershey. um, Observerships are very easy to get. It's just your interest and your ability to reach out to the program director, program coordinator. Any institute is usually happy to welcome any student interested to observe what is happening in their university, because it's pretty much like a free PR for them. So I did my observership just before applying for the cycle, so that I could cover that base and nobody could question me that, oh, you haven't been in clinics for a long time. It's fine. People will still ask you about your journey, and those will be some questions you face, but at least you have an answer when you're trying to cover different aspects of your profile. So I did those pretty much 4 rotations before applying. And then I would say for other specialties, at least from what I understand, people are expecting a lot more from international medical graduates to be doing them, because there are just so many IMGs applying. They need some differentiating factor. So if you can present that in the form of some US clinical experience, that is always beneficial in your application. How many rotations you have to do, I am not sure, but since you need 3 letters at
Three
least for all the
letters. Yeah.
programs, that is what is recommended to be do, like at least have 3 rotations under your belt. But somebody like me, I knew that I will be doing a research year with the faculty, so I'll definitely have to be using that research letter as well, because you want to be using letters that really speak about you and on your behalf the best aspects about you. So all in all, yeah, I would say 3 to 4 should be enough. But there are people I know who do a year long clinical elective, but it depends on how your financial situation is. There are some programs that you can reach out to directly for hands-on rotation that easily charge like $3,000 to $5,000 per month. This is without including your travel, accommodation, food, and everything else. And if you're like me, who has never been outside of India, it can be super expensive to manage all of that on your own, because rotations are considered, something that you take care of by yourself. So depending on your financial situation, you need to be realistic about the programs that you're targeting. I was sure that I didn't want to be targeting paid sort of rotations, but are they harmful? I don't think so. It just depends on how you are comfortable approaching it. There are some private organizations also that I'm aware of that help students with research, sorry, with electives. So if you're okay doing that, go for it. But you also need to be sure that it's a legit place that you're rotating it, because there have been people that were who had bad experiences. Because at
Yeah.
the end, your aim is to get a good letter out of that rotation you're doing. If you're doing a rotation for a month long and still not getting anything out of it, it's probably just a
Waste.
waste of your month.
Yeah. But then you're right. Like, there's a provision of giving 3 letters of recommendation during your application. So you've done 4, and then you also mentioned that after your applications, you still, tried your hands by doing observerships. Now, how do you utilize these extra rotations, no matter it's observership or the hands-on, where the provision is only for 3? So how do you utilize those as a tool to get your interviews in your favor while speaking to the PDs?
Right. So not all rotations probably will end up getting letters that you can use, because sometimes it might be just hard to have them in time, for your application season. So a lot of times people, what they do is they still do the rotation, just anticipating that, it'll be the interview season and they'll get one extra interview through that rotation. How much of that helps, I'm not very sure, because obviously there's no data about it. But from anecdotal experience, I can say that doing as many rotations always helps in competitive specialties, because that's pretty much the only way an IMG can make those people, be aware of your existence. Because you come from a place that they're not aware of, a med school that they're not aware of, a profile that they're not familiar with, because you might be the best med student from your batch, but you telling you got 95% in med school here is non-translatable, because they don't really know what is the benchmark. Okay, you're
Correct.
20, 95%, but how many other students in your class get that? Because there's no metric to say that you're above par, or you're just like any
Right.
other graduate coming from your school.
Yeah, I mean, each country would have their own metrics of,
Exactly.
yeah, absolutely correct. Right. Um, One last question. How many programs did you end up applying to?
Um, Again, it's very interesting to answer that, because as IMGs, applying to a very niche subspecialty like neurosurgery, it's almost like you apply to everything. So in neurosurgery, there were about 116 programs, and I applied to all of them, um, despite knowing that half of these programs probably won't even open my application, because there is probably a way in which they can screen out visa requiring IMGs. But it's just your personal decision. I just didn't want to have any regrets of not applying to a program where you can just sleep peacefully at night. So that's the reason why I went ahead and applied to every program. But it's a very personal decision. At hindsight, I would say that maybe there were a few programs I should not even have tried. But you know what? It's like all done and dusted right now. So um, for other specialties, I'm not sure, because I know for internal medicine there are like easily over 500, 600 programs. So then you definitely have to decide, is it really worth the money that you're spending in, because the whole process is super expensive. And something like neurosurgery, at least all the interviews are again in person. Even if you get as many interviews or more than what you expected, will you be able to attend those interviews? Will you
Right.
be able to spend your money and your time equally? Just, you don't want to be going to an interview underprepared. You don't want to
Correct.
be going there and just making a bad impression, because sometimes it also can happen that in a niche subspecialty, the one program can talk about you to another program. So you still are considered to be interviewed at every program that you go, that you're rotating. It's an active interview. It's not just like you're learning there. You're being interviewed by the program whenever you show up at that program. And it's possible that the program director from one program can talk about you to a program director at a different place. So you always want to be, the best that you can present yourself as. So I would say that it's a very personal decision. You need to have some goals, but to me, it was very easier to just apply for all the programs because I wanted to sleep peacefully at night.
Great, great. I know that you've just started your residency in neurosurgery just about a week ago or so. It's been 1 week, if I'm not wrong.
It's been 2 weeks now.
2 weeks? Okay. How's the new culture, the new environment, excitement of, getting into your dream place that you wanted to be right before you got into the MBBS?
It feels very, how can I describe, very surreal, very still, like, you're living, like, is it real for like what is happening,
But
sort of thing. But at the same time, you already are burdened with so much responsibilities and so much of a different system that exists here. No matter like how many rotations you do, when you have a burden, like, when you're shouldering that responsibility as a real doctor now, taking care of patients, um, there is a different meaning to it. To me, it has been a very steep learning curve of even understanding how to use the electronic medical record systems that are in place at the institutions here, and just understanding the different tendencies and likelihoods of different doctors, because it can be the same pathology and surgery, but different doctors want it to be done a little differently. The management is also dependent on a lot of things that it's not just like a flow chart that you can memorize. So still trying to get myself used to learning what different people here prefer. You also want to be sure that you're learning from the PAs, the NPs, the nurses, because I think they, at least to me in my brief time here, have been very helpful. It's also the case when you rotate, they are some of your biggest help that you can find. Always be kind to them. Always be thankful for whenever they help you, because a lot of times, they also have an input in the program, the administration, so that you want to be the best possible person, not just to the attending or the residents, but also the patients, the staff, the nurses, and the janitors. Pretty much everybody in the hospital has a say. It's not as hierarchical as it is in India. Everybody here has a voice that is heard by everybody else in the table. So you want to be sure that you're a nice person to everybody.
wait, I would have been the program director. Trust me, after listening to your efforts, your story, your journey right from the first year till date. I'm super impressed. I would have said, as a program director, wow, Dr. Sufyan Ibrahim, where were you for the last 10 years? I was just waiting for a personality like yours. It is indeed inspiring. It is indeed tough. The hardships that you've gone through have certainly paid off. And I'm pretty sure the coming generation who are watching this, who want to or who tend to get into the US, is definitely going to be a lot of learning from your side of the story. Having said that, thank you so much for your time, Dr. Sufyan, and we wish you all the very best. And we look forward to maybe connect with you again, maybe next year, so you can narrate one additional set of story as to how was your first year of neurosurgery, so that can give us more insights. Thank you so much for your time.
Sure. I'm very glad that I could share my experience with everybody, and I would say that if I could even inspire one another IMG to, be hell bent and pursue a difficult journey, I would say it was all worth doing this interview with all of y'all and your team. I would say that even during my journey, there were times where I myself had this imposter syndrome of what will happen if everything falls down and shatters. So there are those midlife crises that you face. There, there are people who will doubt your path, no matter how good you are at whatever you do. There are people who will say to do things differently, but then there are the other side of people that will support you, your friends and your family, who will cheer for you for every tiny success that you have. So try to stay with them and make sure that you're surrounded by people that encourage with the dream that you want to be achieving, so that one day that becomes a reality. And it will be a reality if you put in the right amount of effort and time. It just might seem like a long journey, but eventually it all will fall in the right place. So that's all I can say.
Thank you so much. It was indeed helpful for all our students.
Thank you. Have a good day.
Thank you so much.
Subscribe to this channel, tell your friends about it, share this channel with them, and yeah, don't forget to press the bell icon so that you get to know you're the first ones to be notified of the upcoming episode